Hi there, everyone. Thank you for joining us today. My name is Jake, and I'm pleased to be your host for today's Get to Know the School of Occupational and Public Health session as part of Ryerson's virtual open house, which is taking place from November 9th to 13th and 16th to 20th. There are many sessions taking place across these 2 weeks, and we encourage you to visit our website and register for any other sessions that might interest you. To start, I would like to take a moment to acknowledge the land on which Ryerson stands. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. We read this acknowledgement at the beginning of important on-campus events and meetings, and even though we are not on campus right now, we still feel it important to acknowledge the history of this land as one small part of our commitment to reconciliation and decolonization. Ryerson has shifted to an essential services model to help prevent the spread of the COVID-19 pandemic. We put together a series of virtual sessions in order to share information and connect with you. Ryerson is working diligently to provide students with fulsome experiences while maintaining the health and safety of our community. So a few Zoom housekeeping tips before we get started. We encourage you to ask questions. We have many faculty and staff members here to answer your questions. To do so, just use the Q&A pod at the bottom of your Zoom window. Click that Q&A button to open the dialog window and type your questions in there throughout the presentation. We'll also be coming on camera to answer questions live at the end. So yeah, get those questions in. If you're having any audio or video issues, feel free to flag it in the Q&A pod and one of our staff members will assist you. You may rearrange the screen in any way that works best for you, and note that rearranging your screen does not impact the way that others are viewing this presentation. This presentation will be presented with closed captioning to ensure accessibility. If you require closed captioning, please select that option at the bottom of your Zoom screen. Also note that recordings of this virtual open house session will be available on our website later on. We'd like to know who's joining us, so I'm going to launch a poll, and this just sort of indicates whether you're a student who is looking to join us next year. Maybe you're a parent of a student, maybe you're looking to join us later on. If you're coming from university or college, this sort of information just helps us out. So thanks a lot for answering that. And now, without any further ado, I would like to introduce Richard Meldrum from the School of Occupational and Public Health to start the presentation. Richard, take it away.
Thank you, Jake. Good morning to everybody. It's great to see you all here today. Thank you for taking the time to come along and listen to us speak about the School of Occupational Public Health. As Jake said, my name is Richard Meldrum. I am the director of the School of Occupational Health, which means that I am responsible for administering and looking after the students in both the Public Health and Safety program and also the Occupational Health and Safety program too. So we're just going to do a little presentation for you today, just giving you a very basic overview of the structure of the programs, the content of the programs, the requirements to get into the programs, and various other aspects which are fairly standard and general in terms of the information you might need to know in order to make a decision about joining the program. We've also got a couple of senior students here today to talk to you about the actual student experience. We got one from Occupational Health and Safety. We've also got one from Public Health and Safety as well. And as Jake said, I'm really going to encourage you to ask as many questions as possible. We'll do our best to answer them during the presentation and also after the presentation when there'll be a Q&A session. So if you have any questions about admission, if you have any questions about the program itself, if you have any questions about prospective employment after the program, and anything else you want to ask, please feel free to do so. This is the opportunity to do that and get information both from myself, from our administrator who's also here today, and also to the students who are actually on the program. So please feel free to ask any questions. So I'm going to move on to the next slide. Okay, so as I said, it's a fairly straightforward presentation. We're going to do. I've done the introduction already. We're going to look at what is the School of Occupational Public Health, what it actually does, and where we stand in terms of the university. We're going to have a quick look at the curriculum itself in terms of the programs and courses that you'll do. We're going to discuss very briefly things like placements and co-op opportunities. We are going to look at careers, the sort of careers that our graduates actually do fulfill when they after they graduate, and then we're going to finish off and look at admission requirements. But as I said, please feel free to ask any questions. I see there's already a couple coming up in the Q&A, and we'll answer them as we go along. Next slide, please. Okay, so I think we skip that one as well, Jake. Just move on to the next one. Okay, so occupational public health. What is occupational public health? I mean, that's a question that prospective students often ask in terms of what these subjects actually are. And as I said, we do have two different programs. We have occupational health and safety. We also have public health, and they are slightly different. I mean, they do have a certain number of commonality between the two sets of programs. That's why they belong in the same department. But we do have differences in terms of where our graduates go. So occupational health and safety. Now, what really is that? Now, that's primarily a workplace-based career. And what our graduates tend to do is really help prevent injury and illness in all sorts of workplaces. So if you think about the workplaces that you've experienced in your lives, schools, train stations, bus stations, construction sites, factories, retail environments, all of these places that we go on a fairly routine basis, day-to-day basis, there will be health and safety involved in that. There will be people there who are overseeing the health and safety, looking at prevention of injury, looking at prevention of illness. And that's especially pertinent at the moment, obviously, as you know, because we're in the middle of a pandemic. Our students will learn to evaluate injury and accidents, and they'll also be assessing harmful exposures to chemicals, radiation, and physical agents. And you can see how that really is very important in all aspects of our lives and all of our workplaces, no matter where you're working. Obviously, if we think about the more dangerous environments, we're thinking about construction, and we're thinking about mining and things like that. But every single workplace must have some OHS component, because it not only is it legally required, but it's such a crucial part of prevention and of injury and illness. In terms of public health, again, something which is very, very current in the news. I mean, a lot of our graduates are involved in the current pandemic, not only at the provincial level, but also at the national level and sometimes at the international level as well. Public health is very big news at the moment because it's clearly a very important part of the current pandemic approach and obviously, hopefully, the current pandemic end. But generally, in terms of public health, what our students will do when they leave, when they graduate, will be really working to prevent disease, whether that be acute disease or chronic disease. They work in both areas. They also are really generally there to protect public health. We'll look at the careers later on, but a lot of our students will become public health inspectors, which is working in municipal level. In other words, working for cities like Toronto and other municipal areas, and working in that sort of area. They may also pursue things like food safety. They might work in water quality. They might work in quality assurance roles. They also may work in infection control areas within hospitals. A lot of our graduates from this program will also go into government, working in things like policy. Now, that's not an obvious place to go, but there's a lot of local and provincial and national governments who do work on health policy and developing that sort of area. So it's a broad topic. Both occupational health and safety and also public health are very broad topics. You will study a lot of different topics during the programs. You have the opportunity when you graduate to do a lot of different jobs. And really, public health and OHS both are part of really most parts of society. Public health really applies to a lot of areas in society, so does OHS. There's very broad topics, and as I say, our graduates can end up working in a variety of different areas and a variety of different places. Thank you, Jake. Okay, so curriculum overview. What do we offer? Well, as I said, we have two programs. We offer a Bachelor of Applied Science. You either opt for Occupational Health and Safety or you opt for the Public Health option. We have a common first year, which shows how linked these programs actually are. So the students will come in, we'll all do the common first year courses. At the end of the first year, you'll then essentially split into two different streams. You'll either be doing Occupational Health and Safety or you'll be doing Public Health. Now, the link on the screen has the link to the university calendar. So you can look at the sort of courses that you're doing, not just in the common first year, but also in second, third, and fourth years as well. So you can see roughly the sort of program areas and the courses that you're going to be working in and you're going to be studying for those particular different programs. One of the questions that might come up, and one of the questions that often does come up, is if I enter, say, public health and I wish to switch to occupational health and safety, can I do that? And the answer is yes, you can at the end of the first year, because it's a common first year. So you can do that, and you can switch between the programs. And we do have some students who do switch. They come into the program, say, on occupational health and safety, but they decided public health is more for them. And yes, you can switch. Once you get into second, third, and fourth year, that might be a little bit more difficult because you're taking different sets of courses, but it can be done. Yes, Jay, you can move on to the next slide. Thank you. Sorry. Okay, so the school is slightly unique in terms of Ryerson because we have different formats of our courses. The standard program is a 4-year program, and that's really for students leaving high school. So you come in and you do the standard 4-year program and you graduate at the end of it. We also have, and we'll be talking about this in more detail later, a 5-year program, and this is for students who opt to take the cooperative program, and I will provide more details of that in a slide or two. So that's a slightly extended version, but there are benefits in taking the co-op, and we do have a student here today, Karen, who's on the co-op program, and she will be talking about the merits of actually taking that route. We also have a 2-year, and we call it the fast track program. So if you do come into the program and you hear this term fast track, that's what we're talking about. It's a 2-year program for university or college graduates. And that basically means we're offering an accelerated degree. So if you have a degree already, and the type of degree doesn't really matter. I'm sorry, the subject of the degree doesn't really matter very much, as long as it's a recognized university degree. You can come into our program and you can achieve another degree, our degree, the Bachelor of Applied Science, within 2 years. Now, how do we do that is really there's two approaches to it. The first approach is students coming into this program don't do any liberal courses because they've already done them in their previous degree, so we can cut those out. The second way we do it is we increase the course number to a certain level every semester. So students in the fast track program are doing a slightly heavier course load in order for them to accelerate through the program and complete within 2 years. But that's the 3 formats that we offer for students. I mean, the typical high school student will do the 4-year program or the 5-year program. University graduates will typically do the 2-year program. Thank you, Jake. Okay, so you can see on this slide what you would be doing in your first year. And as I said, this is a common first year. This is the first year that all students on the Occupational Health and Safety in the public health program would do. This is a fairly general range, and I think, as I said, it reflects the different types of courses and the different types of destinations that students could take once they graduate. So we start with the general chemistry course. That's fairly standard. We talk about law. So we're talking about environmental health law in the next course. Then we move into pathophysiology, which is essentially an anatomy and physiology course, because it's important that students on both programs understand the major organs, the major functions of the body, because that's very important for both occupational health and safety and also for public health. We move into professional practice program. Now that is an introduction to exactly what it says, professional practice. This notion of what could I do when I graduate? So we get people in from various places, various locations, industry, government, to come and speak to the student cohort to talk about their career pathways, the sort of things you could be doing. We bring junior people in, we bring senior people in, and they get to speak to you about their own career trajectories, which I think is very useful in terms of planning. Then we also do some data management, because data handling, data analysis is very important, whether you're in OHS or PH. We talk about communication as well, because again, that's very important. A lot of our graduates are in positions where they have to communicate with members of the public. So if you think, for instance, thinking about the pandemic right now, how many scientists are on our TVs talking about the outbreak, discussing it with them. Communication is very important, and being able to express complicated scientific information and concepts to the general layperson who may not understand a lot of the information you're saying. So you need to be able to dilute it down so they can actually understand it. We also have the dreaded biostats, which is very important for people who are working in public health and OHS. Introduction to toxicology, which is obviously the effect of toxins on the body and toxic effects. And then we're looking at determinants of health as well, so social and health and socioeconomic aspects of that. So you can see here you do a wide range of different topics in the first year, in the common first year, all of which are relevant to both public health and occupational health and safety. And this really sets the tone for the rest of the program. One of the things that we have, which is unique to other programs, is this breadth and range of topics. A lot of other programs won't, for instance, include things like law. And our graduates are very sought after because they have this range of knowledge, all the way from something which is very scientific, such as toxicology, to understanding law, which is why a lot of our graduates, or maybe not a lot, but a significant proportion of our graduates end up in places like government because they understand law, they understand policy, where other graduates from other programs or other universities don't necessarily have that interaction. So you can see we do a very broad range of topics around public health and occupational health and safety. Thank you, Jake. So Co-op, and I'm not going to spend too much talking about this because Karen will be speaking to it later on, but as I said earlier, we have the 5-year program, which is the cooperative program. Now, I'm a big fan of this. I'm a big proponent of the cooperative program for 2 reasons. Whilst the downside is it increases your program length to 5 years, which some students don't like because they want to graduate within 4 years. The upside is you get work term placements during your program. So what's a work term placement? Well, once you've signed up for the cooperative program, which you do at the end of your first year, as you move into the OHS or public health and safety side of things, you will sign up for Co-op. You apply for it. It's a formal application process. You will be put on the program with a Co-op designation. Once you're in there, the requirement for you to complete that degree is to do 3 work term placements. So what's a work term placement? Well, the university will help you get essentially a job. And these jobs last for a minimum of 12 weeks. And you go into various industries and various places. I mean, some of the employers that we deal with are relatively big. So I'm thinking on the occupational health and safety side of things, we're looking at people like Metrolinx, the people who run the GO trains and all the public transport. Bombardier is another one. On the public health side, we get students who go to public health units to work there, and also some food industry. Maple Leaf Foods will take some of our Co-op students as well. The good thing is these are paid. They're fully paid. You become an employee of that organization. So you get paid by them, you get the benefits from them, and you get a huge amount of experience. Depending upon the level, so for instance, if you're in your first work term, obviously that'll be more of a training position. But as you move through the seniority of the work term, you get more and more experience, you're likely to actually be fulfilling a role, a function. It may be relatively junior, but you're likely to have a role. So for instance, my area of expertise is food safety. So I know that the students who work in food companies, by the time they get to work terms, they're working as quality assurance officers, often in very complicated environments, very high, very stressful environments, but it's such good experience for the students on these programs. And I know Karen, I hope Karen will echo my thoughts. So whilst a lot of students are hesitant to take the Co-op program because in 5 years, because it extends it, you have to reflect that 3 work terms really make up the extra year, because it's 3-4 months. So that's the extra year. They're fully paid and you get a lot of experience. Often, students who leave and graduate from the program with Co-op on their designation will be picked up by the companies who've employed them, because the companies know them and they want to continue that relationship. And that quite often happens. So the students, as soon as they graduate, they're working with a company that they've already worked for, and they're working with the people they already work for, and they're working in the role they already work for. So I think it's really good from an employment perspective, and the money side of things is very good as well. The money that the companies pay is actually very generous, and it can really go towards offsetting things like tuition fees and various other expenses. So I think it's really useful, and I also think it's very useful as the university actually helps facilitate by posting jobs and preparing students for interviews and applications, and helping and providing advice and support for that. So I think it's a very good program. So I would encourage everybody who's thinking about joining us in the School of Occupational Public Health to think about the co-op option. Next slide, please. Careers. One of the things that lots of students ask before they come into a program is, what can I do when I graduate? So I think it's very important to give an overview of the sort of range of positions that graduates do fulfill when they graduate from the program. As I said, there's a wide range of areas and wide range of destinations for graduates. This is just a brief list of what you can do once you've graduated from Occupational Health and Safety. So you can become a consultant. You could become an ergonomics and safety specialist. You become a quality assurance professional. You could become a health and safety officer. You could become a safety project officer or a safety specialist. So that's just a brief list, and a very brief list of the sort of roles that our graduates in OHS can fulfill once they graduate from the program. A very wide range of programs, a very wide range of careers that you can fulfill as you graduate. Next slide, please, Jake. Talking about public health, another very wide range of areas that somebody could work in. So you can become a public health inspector. One of the good things about our degree in public health is that it's certified. And what does that mean? Well, if you want to become a public health inspector in this country, you have to be certified. And to become a certified public health inspector, you need to do one of 4 undergraduate degree programs in Canada. And we're really the oldest, and I'm going to say the best program in Canada to do this. So if you want to become a public health inspector, you have to complete our degree. You have to do a couple of placements with public health units, and you have to write a couple of reports and sit a board exam. And then once you pass that, you can become a certified public health inspector. There's no other route to become a certified public health inspector. And as I said, our degree program is one of 4 in Canada that is accredited, certified to actually produce certified public health inspectors. And public health inspectors are very important at municipal level. They're the people who will carry out restaurant inspections, do outbreak investigations, look at water quality, investigate for various diseases, and do surveillance for those things. Very important role. Vermont Health Office is very similar in terms of function, slightly different, but the 2 terms are almost exactly identical. You could become an epidemiologist. There's obviously a great call for epidemiologists at the moment. This is a role where people do investigate and try to stop outbreaks from happening. So they do things like contact tracing and various other things like that. So epidemiologist is a role that a lot of our graduates will take on, and that can be done at a provincial level in somewhere like Public Health Ontario, or it could be done at a national level in somewhere like Public Health Agency of Canada. Communicable disease investigator, again, a very pertinent role right now. Health promotion, that's something else that we teach, and a lot of our graduates will go into that. As I said, a lot of people go into the food industry, so you can become a food safety auditor, quality assurance manager, quality control supervisor, or infection control supervisor in the hospitals. Next slide, please, Jake. Okay, I'm not going to spend too long going through this. This is the information just taken from the website. This is just the admission requirements required by the registrar's office, so you can have a look at that at your leisure. 4-year programs are fairly straightforward in terms of the high school requirements. 2-year programs are are open to people who have a bachelor's degree or higher from an accredited university, etc., etc. So you can see what the admission requirements are and see where you fit in terms of the programs. Okay, next slide, please, Jake. I believe that said thank you. Well, I would like to thank you. I'd like to thank you for coming along today and taking the time to listen to my rambling. I hope that presentation was informative. It is 25 past 11. We're more or less on schedule. What I want to do now is open the floor to my 2 students who have been extremely kind and actually joined us today to come and speak about the program itself. So I'm going to invite Kyle to speak first. Kyle is a student on our Occupational Health and Safety program. So over to you, Kyle.
All right, thank you, Dr. Meldrum. So yeah, my name is Kyle. I'm the president of the Occupational Health and Safety course union, as well as I'm a fourth year student and a co-op student as well. So kind of done the lap of everything the program has to offer. And yeah, I've done my co-op so far with a construction company. 2 summers now, and I've been signed on for my 3rd for next year already. I've been sent to Ottawa and worked on the LRT project out there as a safety inspector for the company. And it has been an incredible opportunity to be able to go and do that. I've spoken with many of our students that are in co-op, and they've all gotten the opportunities to go work for some great companies all over Canada. Basically, some of our students have gone out to BC, Alberta, everywhere. One of our recent grads got picked up by a mining company out in BC. I was just at a panel that he was speaking at. So yeah, you can go everywhere with this program. And sorry, excuse me. So Dr. Meldrum was speaking about how the breadth of what we learn in this program, we're taught physics, chemistry, biology, everything. And you have so many paths that you can go into. For example, with biology, you can go into infection control. With the chem, you can go into toxicology or industrial hygiene. And with the physics, you go into ergonomics or physical agents. There's so many paths that you can choose. We learn law. So if you want to go into consulting. And I came into this program with a very narrow picture of what occupational health and safety was. And now I can see how many paths there are. And it's just been an incredible opportunity so far. Karen, would you like to speak?
Yeah, sure. Well, thanks for the introduction, Dr. Meldrum, and as well as Kyle. So I'm a 4th year public health and safety student in the co-op program as well. And I can say that, public health joining this program was just such an amazing experience so far. I've learned so many more things than I thought I would have from the beginning of the program. And I know that in the beginning, whether you have an idea of what public health is, it's so much more than just like food inspection. The program covers so many things from epidemiology, communicable diseases, health policy, health promotion, global health. And those things are just so important now, especially with the pandemic. And I think a lot of public health students right now are just like kind of looking at the pandemic saying like, I'm glad that I chose this program. And from all this knowledge that I've learned now, like I'm trying my best to do health promotion, to really advocate for all the public health professionals and as well as, all the healthcare workers right now during the pandemic. And I have to say, like, all of our professors and our program administration, like they are just such amazing people. I have learned so much from them because most, if not all of the professors have actually worked in the field that they're actually teaching. So in those subjects that they're specializing in, and as well as our program administration are so helpful. So you will never find a prof in public health that isn't willing to help you, whether it's for your course materials or like for research. And just in public health program, as well as occupational health and safety, it provides you with a lot of research, just background, and as well as just like different opportunities around our program and around our faculty to explore those options. And now I can talk more about co-op. Like Kyle was saying, I can reiterate that joining co-op was probably one of the best decisions in my undergrad, because learning the material in class is one thing, but being able to have that opportunity to apply it in the field is just instrumental for what you want to do after you graduate, and as well as being a student in the program after you finish your co-op term. So currently I finished 2 co-op terms at PCL Construction as a health and safety student, and then now I finished 1 co-op term with National Research Council Canada, and I'm working part-time with them. So I've had like a mix of experience with occupational health and safety and as well as in public health. So what I really love about the co-op program is if you're joining the 4-year program and applying for co-op, I would definitely recommend it because you get to see different aspects in health and safety as as well as in public health. So you're not limited to just like, oh, I want to go into public health. That's it, right? So you get to explore different options, different career pathways, and figure out what you like to do as an undergraduate student. Because once you graduate, you might not have those options. And having that 1 year of experience is amazing on your resume. Like Dr. Meldrum said, a lot of companies from Ryerson, they hire you after you graduate or would like to extend your term. So I've known many students that have been extended for like a full year term or even longer than that, and then they get hired right after graduation. So gaining that experience also helps you with school. Some of the subjects that you learn after your co-op work term, you've already learned in the field. So having that practical experience and applying it into some of your courses is just so much easier. And as well as I found that I was definitely more passionate about my courses after I came back from my co-op work terms. So it's really great to develop yourself as like a professional, gain those networking experiences with your supervisors and as well as other people in your company, and as well as learning to communicate and building upon your own experiences and knowledges in co-op. So either if you want to go into occupational health and safety or public health, I think those are very good options right now as a student.
Thank you, Kyle. Thank you, Karen. And Kyle, apologies because I forgot you were on co-op as well. So please accept my apologies.
You have
I'm
a
the
lot of
worst
students,
director.
Dr. Meldrum, don't worry. Can't remember everyone.
So thank you to both. I mean, I just want to reinforce some of the points made that, you know, the courses are applied. I mean, we strive to make sure that our courses are I worked in public health for 10 years before I came here, which is they can speak from real experience and real knowledge and understanding. I think there's a ton of opportunity, not just during the programs, not just to do co-op, but also projects and other placements to work with instructors on research, as well as opportunities after you graduate. As Kyle and Karen said, there's a ton of places that our graduates end up working, whether that be in government, whether that be in industry or private sector work as consultants, working in the food industry, working in water quality, working in government in terms of municipalities, provincial government, national government. There's a lot of places our students can go, and I think one of the reasons for that is because we do teach a very wide range of topics, all the way from law to toxicology, which you wouldn't think there would be natural bedfellows in a sense. You know, you shouldn't be necessarily teaching those at the same time, but the program really works very well so that the students who graduate from our programs do have that knowledge of policy and law, but they also do have knowledge of the scientific areas as well, such as toxicology, pathophysiology, parasitology, and various other things, all of which are required for the roles that you will undertake when you graduate. And I think there's a great opportunity for our students to go into a number of different roles, especially now. I don't want to necessarily focus on the pandemic too much, but there's a clear interest in public health. There's a clear interest in working in the area of public health, whether that be directly in epidemiology, where you're doing outbreak investigations and you're working on the ground to do contact tracing and try and solve the outbreak issues, but also in the background where you're developing policy and procedures around how to prevent this happening in the future, and also areas like infection control when you're working in a hospital to ensure that the COVID patients are safe and they're isolated, et cetera, et cetera. So there's a whole range of different areas in public health. But occupational health and safety is just as important in terms of the pandemic, ensuring safe workplaces, ensuring that we have contact tracing, ensuring that we have policies and procedures around allowing workplaces to open and to operate safely. So these are really pertinent programs and courses and specializations right now. And I think it's a really good time to join public health and occupational health and safety, because with the pandemic hopefully over soon, touch wood, with the vaccine coming, there'll still be an ongoing interest in preventing this from happening again and putting protections into place, both from an OHS perspective, but also from a public health perspective as well, to ensure that if it does happen again, we have the controls and barriers in place to prevent the spread. So I'm just watching the time. I'm very, very conscious of people's time. So I'm going to stop now, and I'm going to open the floor to some questions. I believe we got quite a lot already, but we'll do our best to answer them for the rest of the session.
Hey there, yeah. So I'm back, and I'm going to read some of the questions that are coming in through the Q&A. We've gotten quite a few. So one person I saw is looking for some clarification on the curriculum between the common first year and the fast track route. So someone said, since the first year is a common first year, are the courses still the same whether you go the fast track route, given this would have a heavier course load, or the co-op route?
I'm going to look at the calendar, actually. we have a calendar set down on the university website, so I'm just going to remind myself, because I don't want to get anything wrong. The fast track is slightly different. The fast track does not have a common first year. What we do with the fast track program is we've essentially cherry picked the courses that we feel that a fast track student would require to have. So, Jake, I don't know if you can post a link to the undergraduate calendar, or if I can. It's probably far more.
We don't have a chat option, but I did have it pulled up that I was going to respond to this person in text. So that will be in the answer questions in a moment.
Yep. So, I mean, if you actually look at the calendar, because I don't want to, because it'll take the rest of the day to go through the calendar, but if you go through the calendar description, which is on the website, the Ryerson website, you can see the similarities and differences between the fast track and the 4-year program. There is no common first year in the fast track program. It is different. There are similarities in terms of some of the courses you take. So, for instance, in the Occupational Health and Safety fast track, you will take environmental health law, and you will take pathophysiology in the first semester, and same in the public health program, you'll take environmental health law and pathophysiology in the first semester. And there's some similarities between all the 4 semesters in the 2-year program, but there isn't a common first year. So you are taking a range of different courses from different places in order to speed up that process. So no, there's no common first year, and we have taken, essentially, I guess distilled the courses that we have to give to you in order to fulfill the requirements of our certification for public health, and also for a career perspective in terms of occupational health and safety. But without going into too much detail, I'd encourage anybody who's interested in looking at the differences between the 2-year and the 4-year to look at the calendar. So if you just go to the Ryerson website and type in OPH calendar, it will come up, and it breaks down under each individual tab the courses you have to take. And in fact, if you just hover your mouse over the course code, it'll tell you a brief description of what the course actually is, so you can see roughly what the course is if you can't tell directly from the title itself. I hope that answers the question. I don't want to go into too much detail because it would take forever to go through the differences, but essentially the 2-year and 4-year are similar but different, which is a fantastically great academic answer. Sort of thing I always like to say. So I hope that answered your question. Sorry, Jake, carry on.
No, that's perfect. In the same vein, I have someone asking, what opportunities are there for prospective students in the fast track program to gain hands-on real-world experience, considering they're not eligible for the co-op option?
There's 2 answers to that. There's a right now answer and a potentially future answer, and I hope that's not too vague for you. The right now answer is we encourage all students to do research projects, and the vast majority of our academics in the department will offer at least 1 or 2 projects every year with an external partner. So, for instance, I offer projects with Toronto Public Health. That's one of the things that I like to do. So I've got contacts in Toronto Public Health, and we talk to them about the projects they wish to do this year, and we fill those positions with students. So the students do a project in collaboration with an external agency, and that happens quite often across the school. That gives you real world experience, and it gives you connections. Now, that's not necessarily suitable for everybody. Not everybody wants to do a research project, but we are moving, and relatively rapidly, in consultation with the University Cooperative Office, to offer the co-op to fast track students. And I think that is going to be happening relatively soon, because this is something we've heard from current and previous students on the fast track program, that they really want to do co-op. They really value it and they see it as valuable to their careers. So we're responding to that, and we're going through the process right now of allowing fast track students to do the cooperative health option. It's not available right now. As you can probably guess, university administration takes quite a long time to work its way through the various levels and layers of committees, but we're hopeful that we can offer that to fast track students fairly soon.
Excellent, thank you. Someone's asking, is the Canadian Registered Safety Professionals CRSP certification, is that a must-have to work in this field?
I'm going to open that one to Kyle because he's the expert in the room.
So CRSP is a certificate that you can get after the program. It has a work experience portion, which I believe is 5 years before you can even apply. And then it's a massive 3 years now. Okay. It's a massive exam that comes with it. It is a certification that gives you, it'll tell your prospective employers that you can be trusted, basically, if you have that certification. It is not required to work in the field and at all. Most of our students in the health get hired on just as students with no experience, because we're in so much demand because there's so few of us. But if you want those, especially government positions, that's where the CRSP is really going to kick in. And if you're trying to apply for like big management positions for mega construction projects, but that's something to work towards after you get your degree.
Yeah. And I also have to say, just as a follow-up, which wasn't asked, I spoke about the certification for public health inspectors. Yes, if you want to become a public health inspector, you will need this degree. You'll need to complete at least one practicum with the public health unit, and you'll need to go through an examination process. A lot of our students don't want to become public health inspectors. They want to work in other areas. They don't need certification in those other areas. So for instance, if you wanted to work for a public health agency, you wouldn't need that certification. If you wanted to work for a Canadian Food Inspection Agency, you don't need that certification. So that certification is only required if you want to become a Sci-Fi certified, which is the Canadian Institute of Public Health Inspectors certified public health inspector. So that's important to know, that it's not a requirement. It's just something that some students will opt to do if they choose that career route.
I think you may have sort of answered this next question in your answer to the last one. But someone asked, how does the public health and safety program prepare students to fulfill these requirements for the public health inspector certification? It sounds like you actually need this degree to be able to take that certification. Is that?
You do. As I said in my presentation, I believe we're one of 4 programs across Canada who are accredited by Canadian Institute of Public Health Inspection to offer this program. And what we do is we ensure that our syllabus, our curriculum follows the requirements of the Canadian Institute of Public Health Inspectors, to ensure that when students graduate, they are equipped with the knowledge and experience to be able to go into get practicums and then sit an exam and then get certified. So we are preparing you all the way through the program by giving you those key pieces of information. So for instance, food safety, food inspection, water quality, water inspection, the law, the legal side of things. All those aspects that you are being taught are part and parcel of our accreditation, which Sci-Fi requires us. We obviously teach above and beyond that as well. We go beyond the scope of just the Sci-Fi requirements because we are, more than just a training course, but we do fulfill those requirements. We are accredited right now, so that will prepare you. We also, in terms of getting you practicums, Darlene, who is our admin, who's a superstar, does organize career fairs every year, and we have public health units coming to us virtually, obviously this coming year, but they come to us and they will sign up students, interview students on site. So we facilitate the practicum process in order to ensure students get practicums. Practicums aren't guaranteed; they're competitive, and they're depending upon government finance, government funding, because that's just these things we have to live with. But we do our best to facilitate students who want to get practicums so they can get them.
Amazing. Thanks very much. So we had mentioned that sort of during this world of the pandemic that we're living in, public health becomes ultra important and is obviously highlighted in times like these. Someone asked, and we did get an answer to this in the chat, but I'd be interested to hear, or sorry, in the Q&A, but I'd be interested to sort of hear your perspective on it. Do you think employment will still be stable in that field after the pandemic?
I think employment is going to go up after the pandemic. I think there'll be a recognition from local, provincial, or federal government that public health is of crucial importance. I know right now the public health authorities are struggling because they don't have the resources, they don't have the people to actually fulfill the requirements of the pandemic as well as their everyday jobs. Because you have to remember, if you're a public health unit, say in Toronto, you still have to do the everyday things. You still have to do the inspection of the restaurants. You still have to deal with health promotion. You have to deal with health education. You've got to think about safe injection sites, all these things which are not related to the pandemic directly, but they are still really crucial to the public health of the community. So I'm not going to put any money on it because I'm Scottish, but I would definitely say the funding will flow into public health. And this has been my experience of public health outbreaks, food-related outbreaks in the past, where there's been an outbreak, there's been a public outcry, and the government has responded by creating positions or putting money into public health agencies, more for prevention from rather than a cure, but ensuring that this can't happen again, or if it does happen again, they have enough resources and they have the policies and procedures in place. Now, they exist, but I think it's a resource issue. I think public health agencies right now are really struggling from a resource perspective. So that's a really long answer to say yes. I think we will be putting resources into public health within the next 5 years. I think the public will demand it. I frankly think the public will demand it.
Absolutely. Thank you for that answer. Someone asked how many students are in a typical lecture in these programs. And I would maybe sort of expand that question to ask, and I'd be interested to hear the students' perspectives as well.
Yep.
Sort of what is the dynamic like in class? You know, how closely do you get to know your professors and things like that? How much instruction do you get?
Okay, well, I mean, the first thing to say is we're a very popular school. We have 2 very popular programs. We have around, I'm going to just guesstimate, on average, we have about 150 students in the lectures for public health. We probably have between, Kyle, you can really spot me on this, but we have around about 50 to 100 students in the OHS lectures. Is that a good estimate?
Yeah, it gets smaller as you get to the later years, but yeah.
The OHS program tends to have less students than the public health program. So the public health program, again, I don't know the numbers, but I would say is probably 2/3 or 2/3 to 1/3. Maybe that's a bit unfair, maybe 60-40 in terms of split. So, I mean, the lectures can go quite large, up to about 200 people. It can go relatively small, as Kyle said. Some of the later, more senior courses, you may not have more than 40 or 50 in the lecture. In terms of interaction with professors, I'm going to look to Kyle and Karen to make that observation, because I mean, I'll say interaction is wonderful because I'm paid to say that, but I want the real opinions from my student colleagues.
Karen, you want me to lead?
Sure.
All right. So a first year course like intro to epidemiology, you could have 250 between the 2 courses plus people taking it as a liberal. So you'll be in one of the huge lecture halls, but come say 3rd year industrial hygiene with our labs, you'll have a lab with 10 people. The whole class will be 50. You'll get broken down to being at your lab desk teaching, or with the TA or the prof in very, very small groups. Karen can speak to the later year public health courses and labs, but most of our occupational specific classes, 3rd and 4th year, 50, 60 students, maybe. Karen?
Yeah, I'd say generally the same thing. Like first year, you can have classes up to 150, but it is first year common. So many of our first year courses actually just have one section, like intro to epidemiology and as well as environmental health law. So I think it's really great because you actually get to know all the students in your classes in first year. So you get like OHS, PHS, and as well as the fast trackers. So it's a really good dynamic between students. And in first year, like the profs are really great as well. I know they're very open with their office hours. So if you're ever struggling or just want to ask them questions, they're always open to answering questions even in classes and as well as during their office hours. And, Dr. Meldrum was actually one of my profs before he became a director. And he was a really great prof. Like, I think his classes were very open concept. So we were always facilitating like discussions and participation. So you're actually able to communicate with the prof like very easily. And then in upper years, you do get around like, I think like 50 to 100, depending on which class you have. And like they always vary because like fast track is on a different track than like 4-year or 5-year students. So you do get a mix of a larger classroom in public health, but at the same time, like profs are very open and they have like breaks in between classes. So you can ask them questions before class, during break, or even after class. So I've always really enjoyed like my classes. And if we have labs, it's probably like 10 to 20 students per lab, but it's still very hands-on and all the profs are very accommodating.
Thanks, guys.
Yeah, thanks for those responses. I was in the Faculty of Arts at Ryerson, but I think every prof I ever had complained that no one came to see them in office hours. So great opportunities to sort of like get in tight with your profs and get some good one-on-one instruction there. So someone's asked, after completion of the program, do most students go straight into the workforce or pursue further education?
That's a really good question. I was thinking about bringing that up. I wasn't sure if it was the right venue to do that. I don't have the numbers because we don't necessarily collect those numbers, but I would say that there's an increasing proportion of students who are moving into graduate programs directly from graduation from the undergraduate program. They go to a variety of different places. They sometimes stay within Ryerson and do one of the master's courses offered by Ryerson. And just as an aside, we will be offering our own graduate program in occupational health and safety and public health fairly soon because we're going through that process. So some students will go into Ryerson programs. Some go into technical programs, scientific programs. Some go into policy programs because there's a very good policy master's at Ryerson. Some will go to U of T. Some will go to Waterloo, Kitchener. Some will do things online. There's a variety of different destinations for students. Certainly some of our students will have the goal of doing a PhD. In fact, one of our recent students just completed her PhD. She started in the undergraduate program in 2010. And last year, she not only got her PhD, but she also got a gold medal for her PhD. And that was all done at Ryerson almost continuously. So yes, again, a long answer, which is typical for an academic to say yes. A lot of students will go into graduate programs either directly or they'll go. A lot of our students also go into the workplace for a few years and then decide to return to another university or our university to do a grad program because they feel it's important for their career. And a lot of careers, if you want to move up to say management level, will require some sort of master's qualification. So some students will go into the workplace for 5 years, 10 years, and then decide, I want to become a manager now, and they'll come back or go somewhere else and do some qualification to allow them to step up to the next level. So yes, it's fairly normal for us, a definite proportion of our students to go and look for graduate programs.
I can add a little bit for the health side on this one too. So if you want to be an industrial hygienist or an I apparently can't say that word today, ergonomist or toxicologist, those are all master's programs that you would then take after. So you're going to get your base knowledge here in our program, and then you're going to specialize in a master's. From personal experience, almost the entire course union last year, so our president, our 2 VPs, a number of our executives that all graduated were hired within a month, I believe. And they're working at Amazon, Purelator, massive companies. Magna, I believe, was one of them, just picked up instantly. And so you have that option. Now I know one of the VPs, I believe, wants to go back to do masters on the public health side, or is going into masters for public health side. Karen could probably speak to that better. But yeah, there's tons of masters pathways you take through this program for the OC health side, and I believe on the public health side too.
Yeah, I can speak about the public health side. I think like a lot of people actually do masters in public health, either right off the bat after graduation or later on in their career, because there are just so many different like pathways that master's offers. So I know a lot of people go into epidemiology. So if you want to become an epidemiologist, you do have to do a master's and specialize in that. But other great masters are either in health policy or health promotion or even like global health. So those are, especially like health promotion right now, like it is a very like up and coming field, and a lot of people are trying to find ways to communicate better and get information out more efficiently in the public health like industry, and as well as occupational health and safety. I know for infection control, you might not have to do a master's, but you have to do the 1-year certification, I believe, at either like George Brown or as well, or I think Centennial, but Queens also offers it. So a lot of people do specialize in that after generally becoming a public health inspector. Some people right off the bat from graduation will just find their practicum, get their certification as a public health inspector. And then once they've worked a few years, then they'll try to get their master's in public health or specialize in like infection control, communicable diseases. And, you can keep going on with masters of public health. But I think it's a really good option to consider either upon graduation or when you're in the workforce.
Thanks for those answers. So just being conscious of time, it is 11:56, so we've got 4 minutes until the end of the hour. The sun is setting on our time together. The last question that I have to pose live is to Karen and Kyle. What are your plans after graduation? It's the big question for any undergrad student.
Karen,
you want to take that one first? Oh,
okay.
No one wants to go first.
I can go first. So I've signed my contract for next summer. I've been told by the company that I work for that I will be very welcome back as soon as I graduate. They are very looking forward to me graduating. It's a massive construction company that operates all over North America, so I could be sent anywhere. By the time I graduate, my project in Ottawa will be coming to completion, so I could get sent. We have a project in Northwest Territories, out in Newfoundland, Montreal, and that's just Canada. There's the Calgary Ring Road is being built, and then I could go anywhere down through the US too. So yeah, if you want to get into construction and you want to do site safety, which is highly recommended if you like a good challenge, construction is the way to go. But there's so many options, like I've said before. The world is your oyster.
Yeah. So my main goal right now is after graduation to get my practicum and then hopefully write my board certification and become a certified public health inspector. And then later on, I do really want to specialize in either infection control or complete my master's in health policy. And like Kyle said, actually in one of my co-ops, my first co-op in PCL construction, they did offer me to come back after I graduate too. So, the world is definitely your oyster in that point, but my heart is definitely in the public health side. So
come on, Karen, you got to come join Occ Health. Truly the better one.
Go to the dark side.
I can't be talking about public health and join occupational health and safety like in the middle of open house, So, yeah.
That'd be a bad look. That would not be a good look for the program.
I'm heavily biased, so.
Of course. So yeah, that does bring us to the end of the session. Richard, is there anything you'd like to say as parting words for the attendees today?
I mean, I'd just like to say thank you for coming again. That is much appreciated. It's a busy time of the year for everybody, and I just appreciate the time. I mean, check out the calendar description, check out the departmental website. You can see what we do in terms of specialization and expertise. I mean, I hope you are considering a career in occupational health and safety and public health or public health, depends which way you want to go, because I think it's very important and it's very timely that we are considering these areas because they're very important in terms of the pandemic. I'd just like to thank everybody involved, Kyle and Karen, for pitching for us and for the team behind, including Jake and everybody else, for taking the time to set this up. It's much appreciated. And as I said, thank you to everybody for coming along today to listen to us ramble and fight about which is better, OHS or public health. They're both as good as each other. So thank you, everybody.
And if any of the,
Alrighty.
sorry, just going to add one quick thing. If any of the prospective students want to reach out to us, both course unions, we operate jointly together on Facebook and Instagram. So it's Sophie, or at Sophie, I believe, SOPHE. And
On Instagram, it's at RU_Sophie, or just RU Sophie. So
yeah, you can join our group, and we have every student that you could look for, fast trackers, 4-year co-ops, everything. If you have any questions, you can reach out to students there. And thanks for coming.
thank you.
And if you have any further questions, for me, my email's on the website. So if you want to ask me questions via email or set up another meeting, that's absolutely fine. I can discuss further, because we can't cover everything in these presentations. So I'm more than happy to provide further advice and support. So thank you.
Amazing. Thanks, everyone. So I want to say thank you so much to our presenters for a great session. Thanks to everyone on the back end who was working so hard to answer all those questions. We're now going to shut down our audio and video, meaning you won't be able to see or hear us, but we're going to stay online to answer those last few questions that are in the Q&A pod. And I encourage you to make note of any answers that you got in the text pod, because those will not be part of the webinar recording. So get those down before the webinar ends. On behalf of Ryerson University, thank you once again for joining us today. And as always, we hope that you and your loved ones are healthy, happy, and safe. And we hope to see you in the other sessions going on later today. Take care, everyone.